Good evening, everyone, and thank you for joining us for another episode of Advocacy. We're excited to have Wally on Akinye. I'm gonna do it. Akinye Day. Didn't I do it? Did I do it, Wally? All right. Yes,
Yes.
we have him on for Onward Healthcare Services, and I also have my co-host Bunny with me. So we want you guys to lock in because he's going to tell us some information on Onward Healthcare Services and what they're all about. And so we're just going to learn. Again, it's a night of learning. So with that being said, Wally, I'm going to turn it over to you. Can you tell us a little bit about yourself?
Yeah, good evening. Once again, my name is Oluwole Akinyede. People call me Wale. So I go by Wale Akinyede. So I'm the CEO of Onward Healthcare Services. About myself, I had a background in, taking care of the people with disabilities some years back. And it was so awesome, and it was an experience that I really want to be able to build on to also help people with disabilities. This has been some years ago now. And within the last couple of years, I came up with the idea with my wife that, okay, we need to set up this organization so that this could be an opportunity to help people with disability. And the Onward Healthcare, yeah, we are DDA service provider, and we provide ranges of services from personal support to nursing support, supported living services, community development services, respite care, transportation, and community living group home. So all these services, we provide them, and these are approved by DDA and OECQ. Thank you.
Okay. So I heard you say DDA, so my antennas went up. And they went up because, of course, my daughter is transitioning right now. So I just had a meeting today about transition services. And I do know that with transition services, you have the option of going direct support. Am I correct? The,
Yes.
okay. Or you have the option of going the center route. So can you tell us where you fall in with, the direct services or the center, or how you function with the DDA? Tell us that.
Yeah, thank you very much. DDA, the Disability Administration, they give approval, and we are approved for 21 years old and above. So which means we're not going to be able to take care of anyone below the age of 21. So when we talk about transitioning, we're always looking forward to the people that are transitioning probably from the being a teenager, to adulthood, like from maybe 21 years and above. So we also reach out to the transitioning school to, let them know about our program, what we do, and how we can provide the best services for the people that are transitioning out of their programs.
Okay. And that's what I was going to ask, because I do know that, right now my daughter's on the autism waiver. So you all are not dealing with the autism waiver because that's under 21. You all are more so dealing with when they're graduating from school and transitioning into adulthood.
Correct.
Okay.
We take care of people with autism, right? But must be age of 21 and above.
Okay. And that's where most of the just to let the listeners know, for those that haven't reached this point that are not going through that, the autism waiver is specifically used for our individuals who are under 21. Once you get to 21, that light switch goes off and either DDA goes on or doors. Are
Mhm.
you familiar with doors as well, Wally?
Adult?
No, the door system.
The door system.
Yeah, because they have doors as well as DDA. And I think doors deals more with the individuals who have the capability of working. So it's part working, but it's also part services. I'm not totally familiar with doors, but I do know sometimes um some of our centers deal with doors as well as DDA. So that's why I was asking that.
I've
um,
never heard of that, Paula. How do you spell that? Is it Doors?
No, it's DORS.
Okay, there we go.
Yeah.
Okay.
So, and I had my meeting today and they talk more about doors, but I think that's more of for individuals that are higher functioning. So they want, of course, to get them out in the community to have them working, but some portion of it, they still need assistance, but they're not individuals that require full assistance. And I hope I'm saying this right. I'm going to check on that, but I do believe that's what it is. A portion of it is them working out in the community. Well, I don't know if you remember, Bunny, but I think we met them. Did your wife or you guys go to the um expo in Fredericksburg?
correct. So
That's where we met them because I could not remember. And I think, Bunny, you were the one that was
I
going
think they were
around.
in the back. Were you guys
Yeah,
in the back?
mhm,
yes,
yes, both of us
Yeah.
were there.
Yeah.
yes. I remember meeting your wife, I think.
Yeah, but I guess I saw you too. Then she
Okay.
also came to your table. So both of us actually have the opportunity to meet you there.
Okay.
Mhm.
Okay. So with the DDA services, and I think I asked her this, but again, we were all just kind of exploring networking. Tell me, do you all do like there are some DDA services where the centers have like a la carte. Say for instance, the person wants to do self-directed, but you all have an activity, say bowling that particular day. Is that something that an individual can drop in and say, hey, we'll pay whatever the amount is for that so that we can participate in that particular activity? Or is it an all or nothing thing?
So for those kind of program, we're not having a daycare. What you're saying is more aligned to the daycare. This is one of the services that we're still looking for to apply for and get approved.
Okay.
So right now we we more align to CDS for what you were saying, the community development services.
Okay.
So which means we can take up your clients, we can take up your daughter, your son, even if he's staying at home and they've been approved for the CDS, we can come over, pick him or her up and take to bowling, training center, go shopping, and do a lot of stuff that
Mhm.
they want to do to step
Mhm.
out of the house, to kind of improve their life,
Mhm.
to go to the gym, to go
Mm.
and watch movies,
Mm.
to do a lot of extra curriculum activities, things that they see as an hobby that they can do
Okay.
to actually get out those confinements
Yeah.
and also mix with the people out there.
Okay.
That sounds really good. Is there a certain amount of hours that you all keep them?
Um, the we're going to send an approval. I mean, we're going to send SIP and DSAT. So these are something that we send to the DDA for approval.
Mhm.
So we're going to have a justification for those services, the amount of hours. Probably in a day, we can be soliciting for like maybe 8 hours, six
Okay.
hours to do that. And when they give approval, then that means we can do that. But we have to have a justification of all those things. And yeah, so the hours can vary. So it's not
Okay.
something that is so static. Yes.
Okay.
So I think what happens too, and correct me on Wally if I'm correct, and again, I'm still learning, but I think that what they have to do is evaluate each person, and based off of the capabilities, they will let you know, okay, this person is approved for 4 hours a day, this person is approved for 8 hours a day. So that's where you're right, it could vary. The hours could vary based off of the needs of the individual.
Correct. So
Hmm.
the hours can vary based on the needs of the individuals. Yes.
Okay.
And
Okay.
that's what we call PCP. This is the person-centered plan. So this is where the service coordinator, that's the CCS, we kind of put what is required of this particular individual. So they're going to make those documentation and sending those documentation like other things like HRTS and maybe nursing plan. So when they send it over, we use this to be able to develop the documentation that we want to send to DDA for approval of ours.
Okay.
So, Wally, who is sending over these documentation? Are you working with the family at this time, or you working only with a social worker?
So the service coordinator, we're working with them and as well as the family. So the way it works is to put the PCP together. The family will be involved. The like you mentioned, social worker, and as the service coordinator will be involved. So all these people will be the team. So the individual can also decide. The member of the family can be in their plan. I mean their team. So they decide. They put the plan together. They know the requirement. They know what he wants or what she wants, and they want to make sure that he get the best or she get the best of those services. Take for instance, if the person wants personal support, they want to look at kind of the plan, the other things that needs to be done. I mentioned CDS the other time, taking the person out, which I said is different from daycare, and there are other things, other services there that I mentioned earlier on that we do: the nursing support, um, the supported living, the group living. So all these services, we just have to justify the hours, and it has to be documented before the approval can be given by DDA.
Mhm.
Okay, so a family gets once they determine that they are eligible for a certain amount of hours, is there a list of activities or places that the individual can go to? Do you guys have a list that you present to the families? How would I know that my adult um, child with a disability is able to go bowling or go to the movies?
Thank you for that. So to answer that question, um, that's one of the reasons why you have the family member as part of the team that we put together the PCP.
Mhm.
From the PCP, my company as a service provider will look in there and see the capability of your daughter or son
Mhm.
based on the kind of the disability that the person has. Now we know, oh, this person can go for bowling.
Mhm.
It's the family is more closer, the service coordinator is more closer. So they put together the person-centered plan. So this is the actual document that is the focus, the core of what I'm going to put together in the SIP and the DSAT plan. I mean, document for me to justify the service, for me to justify the hour, for me to justify the kind of um, places or activities that could be provided.
Mhm. Okay. Yeah, and that's a good point, Bunny, because what I was wondering is, and this is what when I think about with my daughter with a lot of centers, I think about the one size fits all. concept,
Mm-hmm.
because in the past, naturally, she would go to some of the daycare centers. And even if you have a daycare center, when she was younger, that, caters to our special needs individuals, there's a wide range of capabilities as it relates to our disabilities, our kids with disabilities. So some kids, they could talk, some kids like to go swimming, some kids couldn't. Well, my daughter is nonverbal, so there was some things, even with her having cerebral palsy, she just could not do. So for me, my question is, do you all have like the one-on-one um people that work with each and every person? Like if you have five different people, maybe one person can go bowling or one person can go to the movies, the other person may not. How do you customize the activities for the specific individual? Do you do it on a one-on-one basis, or do you kind of take all of them to go to one place, even though some may or may not be able to do things?
Yeah, thank you so much. That takes me to some of the documentation
Okay.
about individuals. So there are where we look at the justification of being independent. So there are people that they need a full support. There are
Hmm.
people that they need a partial support. There are
Hmm.
people that are independent. They can do a lot of things on their own. They
Hmm.
can take their baths. They can take their food by themselves. So when you look at this, all these are documented. So when I look at it and we see the need for this person to be one-on-one, then we make a justification for that when we're preparing the SIP and the DSAT that I made mention of. So when DDA approved for the one-on-one, so
Hmm.
I'm going to make sure that she or he is staffed by, we always have the qualified staff. So we're going to make sure he's having that one-on-one on all shifts.
Okay.
And if it can be two on one, so
Hmm.
it can be two on one, that two people has to work with one person. So
Hmm.
we have to follow the documentation and the approval to the letter, like this is what is required of this person. So to answer the question, if we have four people and we have one person that is one-on-one, and the three others are not one-on-one, and we have two staffs working with them, then the one-on-one, the one staff take care of the one-on-one to go for the bowling or whatever needs to be done. Uh,
Hmm.
then the other staff actually takes care of the the other ones. So which means we already know the capability. We already know that there's not going to be any problem, no agitating, nothing that can,
Okay.
get out of control for these two staff.
Okay.
So
Okay.
you're gonna provide enough staff to
Yeah.
accommodate the different disabilities and needs.
Yes. So so that's another thing about the nursing plan and the other document, the HRTS that I made mention of. And this actually shows the level of the criticality of the health challenge, the
Hmm.
health challenge that they might have. And this is on the level of we having our nurses to do the um, kind of evaluation and
Hmm.
see what is the kind of the challenge, what is the kind of the rating that could be given. So that's also one of those things that can bring about a decision. It's one of those things that can bring about a justification of we requesting for one-on-one, two-on-one, or if it's someone that doesn't need those um, kind of one-on-one or two-on-one staff.
Okay. Okay, yeah, because I think I know for me, I'm very concerned about the fact that my daughter, it has one-on-one at school. And one of the things that I was talking to, when I met with the people about DDA today, is the way that I look at this is an adult IEP. So it's an individualized plan for my daughter. because there is no one size fits all. And so
Right.
that is extremely important. And I want parents to understand this. You know, it's kind of an extension to me of an IEP. They did say they would evaluate her, they would look at her in every way, and just see what are her needs. And then from there, we will go from there. And then at that point, parents can definitely make a decision as far as, you know, hey, do I want to do direct services? Hey, do I want to put them in a center? But understanding and knowing that you have to make sure that the center can, you know, definitely accommodate their needs. And I think one thing that changed a lot with the pandemic is a lot of people lost staff. I know even in the schools, they,
Mm-hmm.
I mean, it just became a totally, it became an internal pandemic within the schools because they lost a lot of staff. So now we're left with a lot of our students not getting what they need because, you
Yeah.
know, the when they had the pandemic and they had to let a lot of people go, when it was time to come back to school, most of those people had went on and found other jobs.
Mm-hmm.
Did that affect you, Wally, during that time? And if so, how did you guys rebound from that?
Thank you very much. There is always in every business there's always a time to understand the pace, and COVID time is a time where all businesses, everyone went through those challenges, and we're not exceptional. And by God's grace, we're able to rebound because, like I said, our ultimate goal is to help, is to ensure that people with disability get what they need to enjoy their life, to live the life they want, to see themselves the way they're supposed to be as a complete being. So we keep doing that, and we keep putting all our effort in place. So after COVID, we still everything's still fine.
All right,
Oh,
good.
that's really good.
Because that's needed. It's needed. It's
Yes.
totally needed. I think a lot of families went through, including mine, when it came to that pandemic. It was really hard. And I mean, all of us had to make adjustments, which of
Yeah.
course was nothing anybody could do about that. Um, Now another question, do you all service just certain areas? What areas, if so, what areas do you service?
Uh, we actually, so Maryland is divided to about four parts. We have the southern parts, we have the central, the western region, and the eastern region. So currently, we service the central and the western region, and this includes all the counties in those two regions, the central and the western region.
Okay. So that's like Montgomery County, PG County. Because
Uh,
I'm sorry, I know you're talking about the Western counties. I'm not really familiar what's involved in the
so,
Western.
so kind of like the Frederick,
Okay.
the Carroll counties.
Oh,
So all those people are part of Western County. And the
Howard
central
County.
regions, then the central regions, you're going to be looking at places like Baltimore City,
Baltimore.
Baltimore County,
okay.
Alford, and some other counties in there.
Okay. So yeah, you don't come down my area. You don't come down
Right.
Waldorf. What's going on with Waldorf? I mean,
Charles County, PG
Charles
County.
County. Come on, PG County. What's going on, Wally?
Yeah, I think when I'm doing another renewal of my policy and procedure, I'm going to include all the counties. I'm going to
Okay.
include all the counties in Maryland.
Okay.
We really want to serve. We really want to see people, family being happy with our services. And all the people that have passed through, and we have the parents, the family are always so glad to see
Oh,
that we are doing the very best that the individual requires. So we think we need to do more for people. This kind of, to me, is service to humanity. So we need to go to other counties. But I will definitely be going to work on that when we're
Okay.
doing the renewal of our policy.
Okay. Okay. But that's good to know
Yeah.
that you do service a lot of families in those counties. And I know as your staff grows, I'm sure those services will be able to come further down to us.
Uh-huh. Now, Wally, I have a question. You mentioned group homes. Do you guys place individuals in these group homes, or do you go there to service those that are already placed in group homes?
So we have places because one of the things is we have places, they come to inspect it, make sure that this is according to the DDA, the OACQ, the Medicaid way, or the way she look. Let me put it that way. So then after that, we now get people, we get our individual to move in there. So the question is, yes, we have places, we have homes that we put our client.
Okay, so you guys doing inspections and you making sure that everything is up to par to
Yeah.
accept those individuals. Okay, now once they are there, is there a schedule or some type of plan for continued inspections and to make sure that those individuals are getting the appropriate care?
Uh, you mean the inspection from the licensing organization or the regulatory organization? Or
Well,
the inspection from my company?
once you identify a group home for an individual and you go there and you say you make sure that the paperwork is in order, inspection is appropriate for the individual. Once the individual is placed there, is that all your company does, or will you continue to go back and provide services to that individual?
Thank you for that question. So after the initial inspection, to make sure that everything is fine, we start the service. We have the individual in there, and every services, everything that is needed for the individual, according to the PCP, like all their ADL, the activities of daily living, and everything that needs to be done, everything continues, right? So if they're supposed to go to daycare, right now we don't have daycare, but we partner with some people, the other organization that already have daycare, they can come over, pick them up to go to the daycare. So then we have program manager, we have program coordinator. So my staff keep going to these houses to make sure that everything is working properly. We'll have a maintenance team that also make sure if the water, if the temperature of the water is not really okay when the staff, because the staff has to know how to check for the temperature of the water.
Mhm.
So we have the maintenance team to call on, the air conditioning, the heat, HVAC, generally. And they have every sector of the house. The locking, the cabinet, the inside the rooms, where we keep the medication. So everything with this to keep a continuous monitoring of all these homes. So if anything is wrong, we make sure it get fixed immediately. And
Okay.
also, the DJ comes around. They come around to inspect the homes. They come around to check paperwork. So it's a continuous thing. It's a continuous effort to make sure that the services are provided in the right way, and to make sure that these individuals are getting the best they're supposed to be getting.
Okay, that's good to know. I just wanted to make sure that when the individuals are placed in these homes, that they aren't forgotten, that you guys
Yeah,
do
that's
go back and everybody is checking on them to make sure that everything is still in working condition and they are getting the services that they deserve.
Yes. There are a lot of rights. They have a lot of right to so many things. I think I have some of it here. They have rights to
Hmm.
good.
let you know a lot of things. They have to be treated fairly,
That's right.
and they have to have a clean and safe place to live. They have a lot of rights, like they have to enjoy um, what they're supposed to enjoy. They have to have relationship with the peers and the groups in the community. So there are a lot of the rights that they have that
Okay.
they know they have those rights. If things are not right, um, they have to report it. And we have qualified staff that always make sure these individuals are not maltreated. These individuals are getting their medication as at when due. They are, even for some individuals that could be agitating or could be
Hmm.
coming up with some um, actions that might not be perfectly okay with the staff. The staff are trained to be able to give like maybe a verbal command to say, oh, Wally, now sit down there. Wally, stop doing that. So the staff are qualified, they have mandate training that actually put them through a lot of things that needs to be done, a lot of ways to actually be able to talk to these individuals, to be able to tell them things. For the individual that are not verbal, that cannot talk, and that understand sign language, yeah, we have staff that also understand sign language that we're going to assign to those individuals, and they'll be able to tell them what they're supposed to do. So these are all the things that we've put in place to make sure that everybody in our organization, in our homes, even the ones that we're sending staff to take care and like personal support, people that still live in their home, that we have to send staff to them. Everybody are getting the best support, the best services that is expected.
I love
Okay.
the oversight. I
Yes.
definitely love
Yes.
that oversight because you're right, Bunny. A lot of the times, we have, a lot of these companies that are supposed to provide this, a lot of the times they don't. And you definitely, when you don't have that advocate there, it's easy for them to be forgotten. And when I say the advocate, I'm talking about a family member or a loved one that is totally involved in their care. And like you say, coming up with what is it, the PCP you're saying, to
Yes.
have that where their needs are met, they're understood, and they're met. Because I think first and foremost, you have to understand the needs to meet them.
Yes.
Um, so I'm glad you asked that, Bunny, because I didn't even realize that you guys dealt with group homes. So can we go back a little bit and understand, do you all place them in a group home, or is that something that's done through once the evaluation of PCP is created, and say they don't have a family and they're placed in a group home, or the family feels like, hey, they're independent enough, and some of them want to live in group homes. They're independent enough to live in a group home. From that point, are you just assigned, say for instance, my daughter went to a group home. She wanted to go to a group home, and you guys, you all are her assigned care providers. Is that how it works, or do you all put her in a group home? I'm a little confused by that process.
Thank you for that question. So the process is, if one, it depends on what you are approved for.
Okay.
Yeah, it's a D-Day program. And it also depends on what you want for your daughter, what, let's say, your daughter wants to live the best life she wants. So That's what we call self-directed programs now. So for the self-directed programs, you can decide to go through to say, oh, I'm not doing the group home. I'm not getting the money directly from DDA. There's a broker that we pay the service provider, right? You can decide that you want to be the one taking care of let me put it this way. The individual can decide who takes care of her or him.
Mm-hmm.
So the individual can hire or fire the staff.
That's right.
So you get it that way. So which
Can
means
you believe that Bunny Morgan firing and hiring us?
so the individual staying at home, right, knows what he or she wants.
Yeah.
I ask who is going to do the best. Who is going to do exactly what will make her happy.
Okay.
Say, for instance, you're the mother or another family member, and they take care. So my company, we just like make payments. You are like a staff,
Mm-hmm.
but not directly from my company.
Okay.
It's from the individual. So that's one. That's the self-directed program. So the other ones, there are so many people with critical situation that decide to stay at home.
Mm-hmm.
They decide to stay at home with the family. And this is where the personal support, the nursing support, all those things, all those services comes in. Because they are in the comfort of their house. And we send someone over there to go and take care of them. So if they need to take care of anything in the body that's, require medical attention, we send people to take care, maybe probably some hours within a week, to go over there to take care of her or him. Like I mentioned the other time, that me and my wife were involved in this. When she first started to take care of someone some years back, that was like 2011 or 2012.
Mm.
The lady she takes care of, she has to go to the home. And the lady is having some medical needs, like attention. So when there is time for that, there is a nurse that will come in to take care of that part and leave. So you can stay at your house. You don't have to go to group home. And all the cares, everything that needs to be provided, the types of our services will be provided for you. And if the person wants to stay in group home, yeah, good. We have
So
homes.
that's why I'm asking, do you all put them in a group home or do you just provide the services at the group home?
Oh, okay. We everything together. We put them in the group home. We provide the service.
Oh, okay. Okay.
So which
Okay.
means the same thing we can do when
Do
we
you
come
hire parents?
when we come to your house and we take care of your daughter. Now, let's take it the other way around. You put your daughter in my group home. Then all the services, everything that needs to be done, all the activities of daily living, going for appointment, going for skincare, going to
Doctor's appointments? Do you take them to doctor's appointments?
yes.
Wow.
Every
Okay.
appointment, everything that has to do with the care of the body, we have to go for those appointments. Then we have a delegating nurse. So the nurse has
Wow.
to come, do the evaluation, and the nurse has to come within at least once in 45 days, except
Okay.
there is any emergency. And all the nurses, all the caregiver, the direct support professionals that we have, they have to reach out and call the nurse if there is any emergency or anything that needs to be done. So there are medication that needs to be given, like regularly on every shift. There are medication that you have to call the nurse. You have to report. Oh, Wale is kind of having, is complaining of pain. Can I give him Tylenol? You know, there are those medications that the nurse has to give a clarity, like, okay, what happened? Okay, give him one or two. So, because when the nurse come back, the nurse has to take the record, like, okay, when I came the last time, all this medication, this is what we have in there. Now, during those periods, they call me on the morning shift or the evening shift for this, and I give order to give this. So it should be having this total number of medication. So those are some of the work that the nurses come to do. They do their evaluation, the regular evaluation. They do everything that needs to be done to just make sure that individuals are doing fine.
Is
And
your center having parents?
the another thing there is,
Huh?
when people make medication error, that's another thing that people don't want to commit at work, because that can get you sacked. So, or can make you go back to do your CMT training again, or to do so. Everybody has to make sure they are working by book and they are doing what is right. Because
Okay.
by the time minors come, is going to find out whatever is not right and going to be reported.
Now, Wally, I know that there are some centers that's hiring parents. Do you hire some of the parents to be a part of the team?
So when you say parents, you
Or
mean
caregivers? People that may say, hey, can I be a part of the team? I don't know. I'm just asking, like, is there, like, does your center say, hey, for instance, if they may know their child better and they're not working or doing anything, is that something that's an option for the parents to become a part of the team for their individual?
So when you say the team, I think you are referring to the PCP. That is the team that the family can really belong to be able to document what is needed for the child. Now, when you say your daughter or son should be taken care of, number one thing that you need to have confidence in is that these people are capable to do the job. This is one of the reasons you see the service coordinators, they will reach out to maybe so many service providers, having a meet and greet with them. And so the parent, the service coordinator, the individual, we meet, we talk, we can share screen like this. I mean, we can be on a virtual call like this. They can also come to the office and we talk, we ask questions.
But they can't be on payroll.
No, but that's what I'm asking.
Not as payroll.
Why can't they join Onward Healthcare Services? Because, like we did say, and I'm not saying that this
the parents can apply.
Okay, that's what I'm talking about.
The parents can apply.
They're the best.
We're not saying this for their
individual. But when I have a team of people, the first thing that I like to hear, and I don't know about you, Bunny, I love it when they say, oh, yeah, I have a daughter that's autistic, or I have my brother that was, and I'm like, wow, okay, so you know a little bit about their quirks and their meltdowns and their, that's why I'm asking that.
Yeah, I get the fact that they can apply to the company as a caregiver or DSP, right? But I can guarantee that you're going to be the direct one that will be working with your daughter or son.
Right. So, Paula, you can't get hired. You can't get hired and be the caregiver or the person in charge of Morgan's case.
Yeah, and I wouldn't want to. I wouldn't. I deal with her the rest of the day. No, but I'm just saying.
One of the things there that we need to be aware of is that when we have the staff, I know I have qualified staff, right?
Mm-hmm.
But if anything is wrong, I want to be able to deal with the situation without any bias, right?
Okay.
So why will I deliberately hire someone and say, okay, this is where your daughter is, and this is where you should be working?
Mm-hmm.
So will I be able to handle the situation the way it should be? Will I be able to give a command and go by book with the staff? Will I, if she decide that the staff is not, I mean, the daughter or the son is not going for the daycare or any other thing, or if you say he's not going to give him food, I mean, it's not. They can take care of their people. Everybody knows that they can take care of their people the best way, right? But
Yeah,
at the same
I
time,
agree.
there are things that you will take for granted because it's your daughter, it's your son,
Correct.
and you
Correct.
and you feel that, but other people taking care of your daughter or son, we go by book and try to do things the best way because they can't be fired. But you want to take things for granted because it's your daughter or son, and you
That's
think
right.
my company
That's
will
right.
not fire you. So these are all the caveats there that there's nothing wrong in hiring anybody. We don't have any limitation to hiring people. But I've not really come across a situation whereby people say, oh, hire me and let me be working in your group to take care of my daughter or my son. I was like, you know, what I would just advise is that, okay, maybe you can do personal support. The
Yeah,
dollar
nobody can do it as good as I can
and I
do it.
want to send my staff to the house.
Yeah, but I think the whole purpose of this too is to relieve the parents and get or the guardians and give them that free time that they
Yeah.
so deserve. So I'm just asking because there may be parents that's like, I don't want to do that. Listen, they're home with me from whatever. Like, say you pick them up 8 and they come back at 4. I'm just trying to have some mental time from 8 to 4 and do some of the things that I want to do for me. So I definitely
Right.
feel like this is definitely a need in our community. I
Hmm.
think everybody would agree to that. Everybody. Are there
Absolutely.
any cases that have come your way that you said, when I've read that PCP, I'll be like, I can't provide the services for them? Have you ever done that?
Um, so to be realistic, right? A lot of things that happens every day, and there are things that you can only do based on the passion you have for
Mm-hmm.
that business,
Mm-hmm.
that profession, right? So I've seen cases that you have the health risk, like when you have cysts, you know that this is very high. This is very high. This needs care. This needs like um, someone that you need to. He has to be at arm's length. You need to keep whatever staff that you're going to hire needs to keep looking, and the person should not be out of sight at any
Hmm.
particular point in time. So this happens all the time. You can't say you want to do this kind of business, and all you want to think of is to be selective in the people you want to have in your group home or the people you want to serve. No, the business is not for you
But
because
no, I'm just saying, like, for instance, if somebody comes, for instance, let's just say, an eloper, and we know that that can be totally dangerous. Like, hey, for instance, once you open the door, they're gone.
they love.
What if that comes your way and you're like, I don't have the staff for that person to provide that safe environment that Onward Healthcare is known for? Is there a time where you've said, listen, I would love to provide the care, but for their safety and for my reputation, I cannot do that? Is there ever been a time?
I've never done that.
Wow.
I've never done that.
Okay.
Um, what any level of risk, I have to provide staff that have the experience to you look at resume, you look at people that been that be taking care, that be caregiver for years, for 15 years, 20 years. And people have different level of experience in the job, in this job, every job. And I'm not going to look at someone that started last month and say that person should be taking care of that kind of person. You get what I'm saying?
Oh,
So
good.
I know, honey. I'm
Yeah,
like, oh,
that was a
yeah,
question, like, experience.
yes,
How do you connect, those that are well educated, have experience versus those just went for training, have this certificate, and someone comes in the center or in the group home, they have a need. How do you base that person, how you connecting them? Because I was concerned that somebody with a
yeah.
certificate was just going to be taking care of everybody.
oh yeah, it's
For the passion, the person
it's
that is so passionate, but they not capable.
Right.
you know,
I'm going to know because this is a company that I don't want to have any problem with DDA, right?
yeah,
I don't want my company to be shut down. I don't want to have a situation to go to court or so I have to do my due diligence.
Okay.
So I'm my HR, but guess what? I'm on top of everything that goes on in the company. When I say that, we do our verification with those places you have worked before, and we make sure that we find out, the reality of everything you have in your resume, right? So, like I mentioned, we look for people that have very good experience. And one thing I do is I don't mind paying more money to make sure that people really do.
I like that.
Because if I have someone that has to elope and even in the middle of night has to run away from the house, then I really need to get somebody that they will not be on the shift sleeping, and they will like during the daytime before coming for the night shift, they want to take some rest, maybe 3 hours to sleep
Yeah.
before coming, and they don't want to just sit down in the sitting room while the person that taken care of has already gone through the window, right? So and, and they left through the window, and before you know it, maybe the police will now come and knock the door and say, "Oh, hey, are you the one taking care of this person?" So these are the situations, and when you read those things about the person you are taking care of, and this person elope, this person do this person do that, this person can use the fist to break into the wall, and all those things, then you as a staff needs to be like very vigilant. You don't walk carelessly around someone that can just punch you anyhow.
Yeah.
So you don't just sit down, just be there for minutes while someone has already gone into the room and he's not coming out. Maybe you cannot even check on him or her. You can't even. You need to make rounds. Even if the individual is sleeping, even in the afternoon, you need to keep standing up, going in there, check and see everything is okay. So a lot happens in environment that you think someone is in the room, but the person has done something to harm himself or herself, and someone might have even jumped out of the window, like I mentioned earlier on. So it's all about being intentional about the job you want to do. If you're not really ready to do your job the right way, then you can look for another job. And let
Yeah.
people that want to do the job come to my company.
Yeah, and they got to be passionate.
Yes.
You have to be passionate.
Caregivers and those that are taking care of individuals with disabilities, you've got to have a passion and a love
Yes.
for all God's people.
Yes.
Yes.
You have to. You got to have some fast runners on your team. Because
Yeah.
I think Morgan was never an eloper, but I've seen some elopers, and I ain't kidding. They are fast.
Grayson was, as soon as we opened up the door, he would take off.
Oh my goodness. And
Yep,
they are fast. Oh my
very
goodness.
fast.
I think probably
Mhm.
because Morgan has cerebral palsy, she'll try to get her little step
Oh,
in.
she.
I'm like,
I'm so
yeah,
she'll get up there though. She'll get out the way.
yeah, you
You'll be
saw her.
looking more gonna be gone. Right.
No, but I definitely, I mean, I commend you guys for, starting this. It seems like you're very committed to the cause. And I think that's what's missing a lot of times with a lot of these organizations or centers. People look at the money factor and they look at it like, oh, I can make money or I could do this. But then it shows it's a passion that goes along with this. If you're lacking that passion, it's going to rise to the surface. And ultimately, like Bunny said, these are God's children.
Mhm.
You can't, and I know the Bible talks about the fools, and not saying that in a bad way, because they are considered as fools, people that can't make wise decisions for themselves. So a lot of times that's where he presses upon us to make sure that we take care of them properly. And for me, like I say, this is a passion for me with my daughter. Even at her turning 21, I always say my son is my baby. And these are my closing remarks. My son is my baby. My son will be 25. He's totally neurotypical, going out on his own, but he will always be my baby. Morgan takes a totally different place in my heart, too. She would always be my baby, but my husband calls her a defenseless one. She can't defend herself. So that's what we're here to do. I'm here to do the research and ask the questions and make the decisions for her. And that's very important to me, to make sure that wherever I put her, wherever she goes, she can't be in my sight all the time. That I have to know that she's going to be well taken care of. So it's good to hear, Wally, that Onward Healthcare is providing these services that are top notch, because our special needs individuals deserve this. It shouldn't have to be
Absolutely.
something where they're being mistreated or being abused. That's It's so sad that we're seeing that this day and time, because again, people are so focused on the dollar and what they can make from it. So I applaud you, and I, encourage you to continue on doing what you're doing. And I also encourage you to come further south, to come on down now in and get out, just expand. But I know that comes in staff as well. So
Mhm.
I'll turn it over to Bunny to give her closing remarks, and then Wally, will turn it over you to close us out, give us some closing remarks, give us something to make our listeners know your place is the place to go. Bunny.
Awesome. Wally, I have enjoyed listening to you talk about Onward Healthcare Services, and to know that you all aren't just placing individuals in group homes and leaving them there for those that work at those facilities to handle everything, but to know that there is oversight. It's important because we often look at the nursing homes and the lack that some of those residents are receiving, but to know that your company is following DDA guidelines and you take that extremely serious, it helps us because, like Paula said, some of our babies are defenseless, and we are their voice. We are the hands that will fight for them. We are their person. So when we have to put them in places like group homes and centers, we want to know that we are placing our loved ones in a great place that's going to take good care of them and that's going to provide them with the respect and dignity that they deserve. So I really like that you guys have good godly values and principles to make sure that you are doing your due diligence, you're training your staff, and you are putting staff with the appropriate person so that they are able to support um, the individual. So I really thank you for coming on to the podcast and sharing your company with us. And my grandson is just 8, so I don't know where he's going to be when he turns 21. But I may have to call you if God see fit to keep me here. I may have to call you, Wally. Be like, hey, I need you to come take care of my grandson.
He should be further south by that point, right?
Right,
Well,
right, right, right. We're hoping because Grace is just 8 right now, so
you
got
got
some
time.
time.
All
Yeah.
right, Wally.
Yeah, thank you once again for having me on this program. And like I've said, we have services. We offer a lot of full spectrum of supportive services that includes um, community living group home, where we have people taking care of individual, and we also provide the services where we can send our staff to the individual homes to take care of them. And we've God has always been by our side. We're really glad that we're doing the best that is expected to be done in the society. And I want to say that people should just trust and see that not everybody behaves like you mentioned the other time. Oh, some people just want to make money. Yeah, life is not about money all the time.
Yeah,
There are things that you do. Be passionate, have the sympathy, the empathy for others. There are things that God reward by Himself.
that's right.
You take care of people the way they should be taken care of. You
Mm-hmm.
just see how God reward. You cannot be getting some money that is meant to take care of people and you lavish it on yourself, or you don't really care, or you don't. I know that happens out there, and it's something that when I hear about it, I feel devastated and feel like, do we really have conscience? Those things are heartbreaking. So I want to encourage everybody to always provide the best services
Mm-hmm.
and make sure these individuals are happy. They are people like us.
That's
They
right.
should live the same life we're living,
Mm-hmm.
and being not having the same privilege we are having. Being underprivileged doesn't means that we know better than them.
That's
Uh,
right.
so we should just see them the way we see ourselves. If what you think you cannot, the kind of food you cannot give to your son or daughter, don't give to the people you are taking care of at group home.
Mm-hmm.
Just the first thing, just look at yourself. That is this thing that can I also take this? Can I be treated this way? When you have that kind of mindset, you're going to do what is right for the people you are taking care of in your, in your company, um, in your community. Once again, I want to appreciate you. I want to appreciate you for your time, the
Thank you.
opportunity to be here with you. It's been an awesome moment, and
Yes.
thank you very much.
Yes. Well, thank you again. I know it's been a long time coming. We're so packed on our schedule, but we're definitely trying to get, as much information out to our parents, especially during this time of transition. So we definitely appreciate you. Thank you, Bunny. Thank you, Wally. I appreciate you guys. And we appreciate you guys joining in and listening to us. Again, we have our first walk. I'm going to just continue to promote this. We have our first Advocacy Walk November the 8th. We're so excited about that. This is our first annual walk. We are also having a Bunt Cake fundraiser sometime in September. That exact date I will send out to everyone. But again, we appreciate you, Wally, for joining us. And we will see you guys next Thursday for another episode of Advocacy. All right, everybody, have a great weekend.
Thank you.